So the objectives with this, we're going to define exercise and its benefits, understand components of an exercise program and precautions, recognize strategies that will help keep you motivated for an exercise program. So the difference between physical activity versus exercise. Physical activity is what you do on a day-to-day, from day-to-day life, your occupational activities, chores throughout the day, activities that expend your energy. Exercise, consisting of walking, biking, exercise training, swimming, yoga, Pilates, Tai Chi, whatever it may be that interests you, and physical therapy can fall under that. So research on exercise in healthy individuals. This will reduce the risk of disease such as heart disease, diabetes, high blood pressure, cancer, and a slew of other risk factor diseases exercise can improve. Improves your mood and decreases stress. I saw a lot of overlap from the last presentation. Increases your energy, improves sleep, boosts your immune system, sharpens memory, improves your digestion, controls weight, and strengthens your muscles and heart. Research on exercise with chronic disease. There aren't too many other changes there. It has the same benefits as healthy individuals without that chronic disease. There is not research on ECD and exercise, but we can apply the research that is out there for other chronic diseases and exercise benefits with them. So before you start to exercise, you want to discuss with your healthcare provider to establish what is safe exercise for you. Seek out professionals that will take your individual needs into account. And determine what is reasonable for you. What's of interest to you, what's available to you, and cost, and how that's going to affect what type of exercise you choose. Set realistic expectations and goals. Let's go at a slow pace, and that's okay. So exercise as a treatment is an important part of your overall strategy for dealing with your symptoms and staying healthy. We use exercise as a treatment and also as a part of education for how that affects your pain and your chronic pain. The example of the saber-toothed tiger, we use education to understand pain with our patients. Pain neuroscience education is huge out there, and there's a great example that says, that person who was crossing the street and fell and broke their ankle, but yet that bus is coming towards them. They're going to move and get out of the way of the bus, whether they broke their ankle or not. But in that instance, are they perceiving the pain of their broken ankle, or are they anticipating that bus and what's going to happen there? They're probably not feeling the pain of their ankle very much, and how the neuroscience of that sometimes can affect your ability to control and manage pain. So different types of exercise: stretching, strengthening, aerobic conditioning, balance training, functional training, and I would throw in posture and how that affects your overall pain. So stretching, 30-second holds, 30 seconds to 60 seconds, really for 2 to 3 repetitions daily, maintains, improves flexibility. There's great research on as we age and how you lose flexibility with that, and how that increases the kyphosis in your back and moves your head further forward and your shoulders further forward. and stretching on a daily basis and how that can overall improve your function. So strengthening, 2 or more days of the week. You want to exercise with repetitions to fatigue. And this is the thought process that, or prescription I should say, that we use when treating patients with multiple sclerosis. Is it's not 3 sets of 10 and we're just going to push through those 3 sets of 10. It may be 10 repetitions and then 6 and then 4. Wherever that fatigue hits in, that's where you'll stop, take that rest break, and then continue beyond that. You're going to target the muscles that will give you the most functional benefit. So you will strengthen your core because your core is the biggest muscle of your transverse abdominis muscle, part of your core. Provides more of a back brace sensation. That is the largest muscle and some of the largest muscles that help with your standing balance. Glute strengthening is another big one. Glutes is the largest muscle that helps with your sit to stand transfers. And then just strengthening the muscles of your hip, because that helps control your ability to squat and to go up and down stairs. If you do not have good hip strength, that knee is going to turn and fall inward, creating knee pain, ankle pain with squatting and descending stairs. Aerobic conditioning. Determine what activity is most feasible, interest, availability. Intermediate exercise strategy is beneficial, particularly if fatigue is an issue. So this is speaking in regards to energy conservation. So they may say you need to do 30 minutes of exercise a day and that's what's going to keep you healthy. Well, 30 minutes may be broken up, 10 minutes in the morning, 10 minutes in the afternoon, and 10 minutes in the evening, or into 5-minute intervals. Whatever is feasible for your condition and how it feels for you that day. And finding the right prescription of exercise and that what works for you. Balance retraining. Determine what factors are contributing to a balance loss. There's a lot of things that can go into factor, whether it's vision, whether it's proprioception, a sensation loss in your feet of numbness can affect balance also, strength in the hips and knees. Activities must be challenging but need to be done with control. I'd rather an exercise be done with less repetitions and more slowly than pushing through those 3 sets of 10 if that slower exercise is done with proper form. The Wii gaming system is a system that's been, that research has shown improves your balance with exercise. This also removes the barriers of needing to go to a gym and exercise because you can use this system in your home. It increases your confidence and your abilities for other tasks. And then functional training, skills training, practicing skills that are challenging, getting up and down from a chair, toilet, or from the floor. And being able to do that without pushing up and down with your hands. There's a great study that looks at your age and there's a 30-second sit-to-stand chair rise test and looks at how many times you can do that fully standing up with your arms crossed over your shoulders and sitting back down, and what's appropriate for age level. Walking, another test would be a 6-minute walk test. And, getting out and walking, but it may just be walking a couple houses and back. Walking down to whether you measure it by houses or a block, doing what is feasible for you. You may want to, yes?
Sorry, where would you find that
If you looked up chair rise test, I'm sure you would find that test in the norms for that test. And that is a great one also in regards to osteoporosis too. That has a lot of evidence with osteoporosis in that specific test. Functional skills in regards to your bed mobility, your ability to get in and out of bed versus rolling over in bed, and practicing those specific skills and breaking it down to where rather than just sit to stand, for instance, you may start off using your hands or just go halfway up and back down. You don't have to do the full task. You can break it up into smaller tasks. And stair climbing, whether you're using a handrail or the specific height of a stair. So exercise precautions, the no pain, no gain does not apply. Exercise within your own capacity, not beyond that capacity. And if fatigue is worsened with exercise, take note and modify your program accordingly. I see a lot of patients with other comorbidities, whether it's chronic fatigue syndrome or fibromyalgia, and this energy conservation techniques that we need to definitely individualize and find out what is the correct exercise prescription. Make sure you're staying hydrated. And then good nutrition is a key to having energy available to exercise. So what techniques can we use to stay motivated? Making it fun. So finding out if there is a decrease in your functional abilities. What did you previously enjoy doing for exercise, and seeing if we can modify that. Exercise with a buddy. Set small, attainable goals and reward yourself. Put it on paper or schedule time for it. Be flexible and kind to yourself. Yeah, and just small little rewards. My grandmother walks a few miles every day, and she every mile she rewards herself with a little mint. So that's what that reminded me of just there. The bottom line is to control the things that you're able to do. Eat nutritious foods. Exercise, a little bit is better than nothing. Have a balance in life between work, rest, and play. Have a positive frame of mind. If you think it will be doom and gloom, it probably will be. Attend your well visits, again with stop smoking. And be an active participant in your medical plan. Find things that you enjoy and that replenish you.
What are well visits?
Your family physician visits, your annual visits. Yeah. So also what I just want to throw in regards to maybe just some of the little things that I find help with my patients in regards to posture is posture when you're sitting versus posture when you're sleeping, and it can be in different positions. Typically, when you exercise and you're so fatigued afterwards, sometimes that pain isn't caused by pain when you exercise. It's more when you're so exhausted and fatigued. What position are you in when you're so exhausted and fatigued after the exercise? So making sure after you do that little exercise that you're getting yourself into a good position, whether it is in that reclined chair, which is perfectly fine, but you're not sitting slouched on the couch. You're putting a pillow behind you, some type of lumbar support that helps you sit with better posture with your feet on the floor. Same thing if you're working at some type of desk or working a computer workstation with that lumbar support. I say another idea would be to grab a roll of kitchen paper towels. That's great lumbar support. Throw that with your sitting all the way in the back of your chair, right above where your belt line would be, and see how that helps and assists you in sitting up tall. For sleeping, if you do not have pain first thing in the morning, it's probably not your sleeping posture that is causing and leading into the pain. If you do have pain first thing in the morning, it could be something that could be potentially looked at. Sleeping on your stomach is probably the worst position, I would say, in regards to neck pain specifically, just because you can't be in a neutral spine alignment with sleeping on your stomach. On your back or side, either one is fine there because you can find a position to be in neutral spine alignment. And my trick there would be you're staying in a hotel, you don't have your normal pillow, which you sleep just fine on. And take a extra towel, fold it in half, roll it up, a smaller towel, slip it inside your pillowcase to give it that small little hump and provide yourself, whether you're sleeping on your back or your side, that little bit of decreasing that space and providing yourself that there. So that's just a few extra little tidbits that I have in regards to posture and how that can affect exercise. Any questions in regards to exercise, prescription for exercise? Yes? So when you've lost your balance, meaning that you're on the floor and fallen, or lost your balance in regards to how can you improve that?
Lost your balance. 360 degrees. Been in physical therapy for 40 years. Don't regain anything.
Yeah, so I would say physical therapy, there may be different approaches that you could use to finding your balance. There's whether it's an inner ear problem and needing to be looked at that way, or whether it is strength and control of that. Lost your balance from frequent falls and what to do when you're on the ground and you've lost your balance. Now that's a safety concern in regards to if you're by yourself, how are you going to get that help? Keeping that cell phone on you or whatever it may be to have that help. But when you have fallen and you're by yourself, if you have the physical ability, the best way would be to, if you have a chair next door and you're able to push up on that chair. Otherwise, it would be more getting into quadruped, hands and knees, and then coming up into a tall kneel or half kneel position and pushing up from that position there. That would be how you would do that by yourself. Your balance from there. Yeah, so I would say seeing, and it's hard to say a specific exercise without knowing a level. Some of them that we would take a look at in the clinic would be your feet together? Are you balanced with your feet together versus feet apart? Are you balanced with one foot in front of the other? And if you can't balance there, maybe you're taking it and just going halfway. Does it affect eyes open versus eyes closed? You have more loss of balance in the evenings with the lights on versus in the darkness, and are those rugs an issue in your home?
That's like a physical therapy consultation is in order.
Yes.
Possibly.
Take one more question.
What do you think about using arm crutches to learn how to walk?
Arm crutches to learn how to walk?
Yes, instead of a rollator or a walker.
I think it varies it depends on how you're able to get the sequencing down and if that sequencing assists you versus using a rollator or a cane or walker with that. I think that is also very individualized as to how you can, if you have the capability of getting that sequencing and being comfortable with the sequencing. Yeah.
Have you ever thought about where your arms go when you walk? Just think
Yeah.
about it for a minute. That's hard. Because your arms, you got to go opposite of your feet.
Sure.
We may have to put in a physical therapy session next time. I think.
Yeah.
Good colleague.
Yeah, yeah.
What about
Yeah,
you?
now, let me just, with the osteoporosis, there's a, they use walking sticks.
Yes.
And the higher walking sticks, and there's evidence based on that in regards to using those walking sticks and increasing your bone strength and bone health there. I just want to throw that in for you.